I thought for some time that I should make a video about how I feel and what I've been through over the past 4 or 5 years. Um, Honestly, since I was about 5 years old, I've struggled with my weight. I remember coming home as a young child, only having a snack at school and asking my mom for lunch, like a peanut butter and jelly sandwich. And um, I remember very distinctly feeling guilty for asking for that because my mom would say things like, um, "You're hungry? Didn't you eat at school?" When, the snack that we had was really just cookie and a carton of milk. And so, yeah, I was hungry. I was hungry. Um, I've learned as an adult that I probably formed pathways that um, are, like a mental shortcut for the chemicals in your brain to associate pleasure and happiness and peacefulness with food. I know I did that from a young age because my parents were fighting a lot. And we grew up in a chaotic household with a mentally ill father who was verbally, emotionally, and sometimes physically abusive. So I know I formed those pathways. Um, and I've discovered since being an adult, those pathways are the hardest thing to change. And I want to change. Every time I go to a doctor nowadays, they tell me I need weight loss surgery, that I need gastric bypass surgery. One doctor recommended that I go to the Mayo Clinic in Rochester, Minnesota and get malabsorptive gastric bypass Roux-en-Y surgery. And that scares me. And I went to the doctor today and he said that I need gastric bypass. But that's not what I went to see him for. In August 2012, I went into the hospital because my feet were swollen. I couldn't breathe. And I didn't know what was wrong. And when I went into the ER, one of the nurses told me, "I'm sorry, Mrs. Maggio, but we think that you have congestive heart failure." And that scared me. And I immediately changed the way I ate. I am on a low sodium diet. I am not perfect, but I'm trying to lose weight. Um, I lost about 60 to 70 pounds, and then I went back into the hospital for heart failure again in December of 2014. And then after that round of hospitalization, I lost about 40 more pounds. So in total, I lost about 101 pounds hospitalized twice for heart failure. The second time I was hospitalized, they scanned my whole body with ultrasound, and they were looking for blood clots. But they found a huge benign tumor on my thyroid. But that huge nodule sent me to go get more pictures done, and they found 3 smaller cancerous nodules on the right side of my thyroid, on the right lobe. And so they took my whole thyroid. So since they took my thyroid, I've been on levothyroxine, which is the thyroid stimulating hormone, and that's not gone so well. My surgeon prescribed 125 micrograms of levothyroxine, and then when I went to my endocrinologist, she put me on double that dosage, so 250 micrograms of levothyroxine, but she made it clear that I needed to take the Synthroid. Well, I started losing weight without even really trying, and so that convinced me that my thyroid had played a huge part in my weight gain. After I had my first and only child, at the age of 30, I gained approximately 150 pounds in the span of 7 or 8 years. So that was a lot. So that should have told me something. But my whole life, people just told me I was lazy and fat, and never tested for any kind of thyroid disorder. But that's not uncommon. So back to the problems with the levothyroxine. So my endocrinologist turned it out to be kind of a jerk. Well, at least her nurse was. And I couldn't get the radioactive iodine that they had wanted me to get because I had cancer, which is fairly common that they prescribe the radioactive iodine. But because they coded it wrong, I couldn't get the treatment, and I was going to have to pay $5,000 out of pocket to get the radioactive iodine. So, time ran out, the end of the year came, and I decided not to take the treatment because I didn't have $5,000. And so, because I refused the treatment and for other reasons, arguing with her nurse, who was very combative, Patel, my endocrinologist, released me from care and wouldn't treat me anymore. So I potentially could have cancer in other parts of my body. I was no longer under her care, so I stopped taking the Synthroid, and I went back to the prescription that my surgeon had given me, which was 125 micrograms of levothyroxine, which is the generic. And so I started taking that, and my weight, I gained 38 pounds in just 4 months because I was taking generic levothyroxine, and that's shown not to work in patients with no thyroid. So I have no thyroid now. I am gaining weight. I may or may not have cancer. I went to the doctor today because I fear that I have a hernia in my upper abdominal area, and he was very insulting. He basically blamed a lot of my problems on my weight. I went to him to find out if I had a hernia, and he said that I needed gastric bypass. He was incredibly rude and dismissive, and I'm just so tired and scared. just need someone to believe in me. I need someone to help me. I pray about this all the time. I'm scared. I do believe that as a Christian, that no matter what happens, God is in control. It's just so frustrating when you meet with doctors and surgeons and they refuse to even treat you because you're obese. Today he said I wouldn't even perform surgery on you because you're so overweight. I don't even know if we would have a bed that would accommodate you in surgery. And I said, that's funny because I got my surgery for my thyroid here at St. Luke's, so I know, in fact, that they do have beds. And he was like, oh, okay, well, that answers that. And he said, well, I want to get a CAT scan of your abdomen, but I don't know if any of the beds will accommodate your size. And I don't know if a person who isn't overweight can even understand what I'm talking about. And the nurse said that she called over and she said, no, you're fine, it's fine. You know, they can accommodate you, it's no problem. So the doctor didn't even have to say that. He's just being a jerk. And I had to stop him and I said, you know, I don't know any other way to say this, but I feel like you're treating me with prejudice. And he said, oh, no. I'm just telling you the facts. Whenever anybody in my life has used the excuse, well, I'm just telling you the facts, and they're being hurtful, it's because they don't know how to be a kind person and still tell the truth. And I think that a lot of people struggle with that, to speak truth into other people's lives and still be kind. That's really hard. I struggle with that. So I guess I have to give that doctor grace. But I'm slowly realizing that in the medical community, they look at me as just an inevitability because it's just a matter of time before I get weight loss surgery. It's just a matter of time before I die. It's just a matter of time before I realize what my options are. And that's so frustrating that the only treatment that I can get is not for what I need treatment for, but I just need the gastric bypass and that will solve my problems. And I understand what he's saying. It's hard to perform abdomen surgery on someone who's overweight because there's extra tissue. I understand that in hernia repair, you know, if he fixed it and then I'm still overweight, that it would probably tear again if that's indeed what I have. But then he said something else that was equally disturbing. He said, well, if it's not a hernia, which I don't think it is, because he said the location was strange. And I said, even though I was injured at that site, and he said, well, I don't think you were really injured, which is a bizarre thing to say, but it could be cancer, so I would want to send you to get a scope of your stomach to make sure that it's not cancer. He said, I'm not saying you have cancer, but it's a possibility. So this doctor was just the worst. And he basically said, you know, I couldn't even perform surgery on you. I would recommend you to a bariatric surgeon because he wouldn't even perform surgery on me. Um, so anyway, I went to the doctor today. He gave me a CAT scan order, which is what I needed anyway. I won't be going back to this doctor, but at least I will get pictures of my gut to see, what's going on, and I'll probably end up going to another doctor and he can look at the CAT scan. But I'm just so frustrated with everything, my whole health journey lately, and I know I should be thankful that I'm still here. I should be thankful for my troubles because it gives me a voice to speak for other people. I'm just so tired and exhausted. I finally found a really good job that I love, and I'm afraid I won't be able to do it for very long. I need help, and I'm not sure where to get it. I'm fighting a battle against my own body, against doctors, against people who don't believe in me. It's so frustrating. I feel like I've been fighting battles my whole life, and it's so hard to be positive every single day. I just had to make this video because every time I go someplace, I feel eyes on my body judging me for who I am and what I look like. But would you feel differently if you knew that I was sick? Would you feel differently if you knew that I had possibly thyroid disease since I was young? Would you care that I'm in pain a majority of my life? Would it matter to you that if you knew that I was abused by my dad? Would it matter to you if I was a Christian? Would it matter to you? I'm a person. And the next time you see somebody who's overweight and they don't fit your idea of what a human being should be, maybe you should just give them grace because they're fighting a battle. I just want respect, love, and grace like every other human being wants on the planet. I just want to fix my problems. I want to beat this. I want to be there for my kids. I want to succeed. I want victory. I want a chance to love other people. I have a voice and I have things to say and I have value. I'm just tired of being looked at as a worthless human being who's lazy and doesn't try. I'm I try harder than anyone I know to get it right every single day. I hope that if you know somebody who's struggling with their weight or with medical issues, that you just share this. And if you don't share this, at least listen to them, be there for them, just give them a hug and a kiss, and just love them and stop judging them because it doesn't help. Love helps.